So when we talk about injuries, they're inevitable. Basketball is a contact sport, admittedly often a collision sport. It's amazing that we don't have more injuries. I think it's a testament to how elite of an athlete these guys are, as well as how they take care of themselves. But some of the common injuries, I really categorize them into two categories. One is macrotraumatic. So that is the athlete that had nothing going on and has an injury where he has a bad ankle sprain because of the way he came down from a rebound or the way, whatever. That's a macrotraumatic injury, or if he gets elbowed in the nose and fractures his nose. So that's inevitable, really hard to prevent, but the most common injuries we see are usually foot and ankle and then hand. And we do see a fair amount of facial injuries. Because of what we have available at the clinic, I'm trained to evaluate those, and I have a very good understanding of those injuries, but I also have a team of consultants. So we have a hand consultant, we have foot and ankle consultant, we have oral surgery consultants and plastic surgeons who consult on facial fractures. We have orthotists that we use who make those masks that you see the players play in. It's all the stuff that happens behind the scenes. So that's macrotraumatic. Those often result in a lot of games missed, because if you have a high ankle sprain, we know it's going to be between 35 and 42 days. I can mark it on the calendar, and I know exactly what this player is going to be feeling once he returns, and we communicate that. If it's an inversion ankle sprain, for you and me, we'd probably be out 3 weeks. They may be out for a quarter, and then they're back playing because they can recover, and they've also done it a fair number of times, and so they're kind of used to that. Some of the finger injuries, those can be dislocations that we reduce right away, or they can be some fractures that require surgery, but those are the common injuries.